Ebusafo emunya kwaba ediba hack media so. We adwumadi a yatu di say your health, your wealth. Wo mu say yapomuden ohia. So kwekukra me yate asese. Ba bia wajapade won ho na wakoma enso ewo. Etinye na pomuden eni yen ahonya. Eno ne dwumadi a de bia ne da ye de ebro hack media so. Ye ne adokotafo a omakwadane ewo pomuden ho. Ena etwesa enkomo ne ne ye nya doctor pani wo ha. Eno eba behwehwe enkomo. Yenwie no na obia nso enya no chefa enso so ewo ahanum sei nene enye obia se doctor tete doc kwa ba bibia wo ko de edan yankopon ase na ka se doctor tete a patcho ne hwan
Me kasa Dr. Teta, pharmacist, we upon KNUST,
okay
na my demand so kakra ben females na ubuswa se obehwe arefo ama ompuntu ewo apombi afin so ompuntu wo yarefo so akon
agusafo we de yina yete doc akwadan ewo eye ese pharmacy ai ewo kwa me ko shop mu ene wa twe enkomo nene etare da so no ene obehu ohu de ko kwa fa so ye fa nru eye anase enye na asan nyumako be na maso ya say de de ebrokedu gas no be sebra se uye nyumako hodo na se mo adwane na se mo pe gas oven na se stove papa dia enfo ni enkoche be bia fa no kwhyem e wo he edu gas and oven ono so betimi abo be so timi kama owo eso me police station na chi ope na so mutu odi ni juma okwa ka se ke happy ya se nra omo discount kama no ba de screen na se no ofre na bebia obi no so betimi e deliver so etimi e dia bro die di akoye mu no enso betimi aboa enwandro no yakopon se yenni aduaba no yefna haba no ensele eno entina ujo not excel enso ede enwandro etimi dia bre supplement ahodo nyina akofa enso etimi ede abreye se wo peanut anase sesa weni ahodo ni nyina no enso etimi boy mo get me dia fusane e control the blood sugar ni adade nyina eno nso obehu omo ewo oboase eye ho say pack eho eno mutu omo so omuno mujuma eye behind old mekom honom pe ena omo so edi omo juma obetimi afro number no ego screen na se no bia obia no omo so etimi edi abrom nene echa de da so ene say OTC doc e ka so OTC e dia dia
me that's me me ka OTC a shortened form of over the counter. In draw ahodo a yenom no. Your classes out of be your class A, B, and C drugs. In the class C drugs no, any a friend over the counter medications. In draw ubit me aqua or pharmacy without a doctor's prescription. It treats common and minor health problems. The say cold, cough, headache, and the rest. In the most common OTC medications are in your paracetamol and brofocasem American folk friend acetaminophen and your ibuprofen, your diclofenac, and I think so your antacids, and so yeah, and over the counter medications that yeah, they treat heartburn and indigestion and digestive issues. You can't OTC kakra me can found.
nese enu um paracetamol ni ade no ho ne tonton no nenu akese doctors no di eye operation na de wunya bi wo ho
Me patch there.
okay ibedu na obebusa ene dey be sure say over the counter medications and supplements ene eho ene ba gugu efi ankono bia nso etimi enya ne de ene kwa fa so mu ye nuru overdose anase wo ha ono self medication ono akoto do no ono ene ba besua de etu etumi ede afa ho enti ene no ye bebusa say o say what are the over the counter medications
Okay. Send me trim na over the counter medications in draw you bet me acquire pharmacy without a prescription. They been a boy and paracetamol, antacids.
then no advice I will say what I betimi akọ
Yeah, allowed. Say patient they and trauma. And nso nkyerɛ sɛ wokɔtɔ saa nnuro no a wonim ho nimdeɛ. Yɛtɔ wɔ aberɛ a yɛwɔ ho nimdeɛ ne adeɛ a ɛkɔyɛ ama yɛn. Nti yɛde treat common and minor health problems a ɛho hia sɛ wɔbɔda doctor about it.
no ɛyɛ adwuma.
Yeah, ɛyɛ adwuma paa.
ɛyɛ adwuma. Oh, okay. Because I was going to say, what's it kind? OTC pain relief works. ɛyɛ adwuma.
Yeah, ɛyɛ adwuma.
Okay, ne mu no won count for many people say doctor prescribe ma wa. Because I was to tell you ya. So how to. Ebu na tell you but e be nya paracetamol na be no no na ebu na bia na foforo.
Yeah, so usually for autism analgesics, I been paracetamol, ibuprofen, diclofenac, aceclofenac. Some popular brands beneath Zulu, your Brufen, your Tylenol, your Panadol. Sa brands na and drama we na. So tell Yana say who you saw, you so embro 3 days unya make an improvement in your health. So you soup for about 3 days. That's a headache no. A good soil was in prudent and I say advisable sell the doctor and our pharmacist. Na ABI amount. Na say as I say check your BP. Any you maybe a movie mawa
Now, can OTC medication interact with the prescription drugs?
Yeah, OTC medications interact with prescription drugs. One of the key medication safety principles is every patient keeps a medication list. We have patients in draw fan. I was a withdraw at all, and I say we draw fan. Jabanesa now call pharmacy. Uma pharmacist knows and do in a medasu and do in a mefa. A beboa guide pharmacist number when we say, and so say this particular OTC to this patient for this particular problem. Young fan say, Oda antihypertensive bit say lisinopril. So, lisinopril, antihypertensive, interactive with NSAIDs. A bit me reduce kidney function. And he said, "Oh, that a drobi so that's all called hospital, oko pharmacy, and our OTC shopper. Also, your own who say all that said, but it's best purchased at the pharmacy rather than an OTC shop. The America said best purchased at the pharmacy. And said pharmacist is more knowledgeable than an OTC medical seller. You bet me a boa guide wama why make it the right choice. Ebe boama unya how bia e wo ndro na enko interact with one type na ofana ma how being enkofa na enkofa how bia
Nti omo ena omo no mo to se de bobo ebiso no yehu se saa enura kese ne bi wo hono mo a emra metimo media na
but your sign brave more.
so omo no so ye sha se no ubo sam common drugs bi abetimi ateki wo hono na me se enura kese ne bi wo hono mo a doctor ne prescribe ya ma wo ekunye bi wo hono mo a e wo kese beto anase ne ko so wo to bi emra metimo media na.
Yeah.
Because we shall say you in this one.
Yeah. Okay, every facility biawo the limits and I say draw ultimatum. The chemical shops draw ultimatum. Over the counter shops ultimatum class C drugs. Class C drugs na me bubo so no class A, your class A, B and C drugs. Over the counter shops ultimatum class C drugs. But over pharmacy, there pharmacy class A, B, and C. Regulatory bodies, some over that's class B or A drug over the counter shop, they can. They're in charge of the shop no one. sana pharmacy so the pharmacist prescribe bibi bro na ho den so wa brand near emergency a ono so ne ho betimi a kyerɛ no wa brand be hu ho asɛm na na kyerɛ asɛm
ade ni makɔ mu de nipa nkwa de fenya gosa
yeah
mo se bisa se na no ma ja biduro ye na ja de be to ye na de se di ebiduro efra abrofuduro anom ensanso pa ana se ensanso bɔne
well see you can say natural a bedroom and natural and don't just say AC. One misconception about herbal medications and I bedroom and if I be then if I be say once a natural AC, but then just a bedroom so a side effect. A bedroom so one year a bit mean your way in bedroom so what brown be fan abro so and I say be fan fire and your fine papa so. And as a bepa, a dear fra abrofudru, its minions so a few examples. It's answer research be enquire bedroom and ma yintimi cite some side effects, popular side effects, and I say intimi and the state side effects were bedroom said the abrofudru ya research a drama you want the side effects. Nti ya FMP eno na ma ye ho kyerɛ wɔ ebiduro ne abafuduro nsɛm kan nanso ebiduro ahodoɔ bi a yɛtumi ayɛ mu nhwehwɛmu bi te sɛ St. John's wort a ɛyɛ antidepressant yɛka sɛ antidepressant a yɛde ma ɔmo a ɔmo yɛ depressed anaasɛ ɔmo a ɔmo suffer from depression adwendwen any yawdi ɛda ne so na ɔdwendwen na ɔdi yaw nsafoɔ no ɛne ɛde antidepressant ma wɔn nhwɛmu akyerɛ sɛ St. John's wort yi a ɛyɛ antidepressant ɛsɛbi as antidepressant yɛ ɛne some other antidepressants ɛnhyia nti sɛ woma saa aduro no na ɔsan kɔma another antidepressant a ebetumi akɔfa haw abrɛ nipa na ɔno haw no betumi ayɛ hu nipa ama nipa ɛna yɛwɔ aduro bi te sɛ ginkgo biloba nso etumi interact with aspirin ɛne warfarin so nti ebiduro no bi wɔ hɔ a yɛtumi ayɛ nhwehwɛmu yɛtumi ehu ne nsusuansoɔ how interact with other prescription drugs but yɛn mu dodoɔ naa wɔ hɔ a esan sɛ ebiduro no dodoɔ naa wɔ hɔ a esan sɛ nhwɛmu research bebree nkɔ mu mbaa a ɔtɛn ma ehu sɛ ebi a ɛne eduro wɔ nhyia ne eduro wɔ nhyia nti me best practice a yɛde ma me patient ne sɛ ɔbɛfa abrɔfoduro ne ebiduro abɔ mu a one day a nka fa w'abrɔfoduro no anɔpa na wafa ebiduro no anwummerɛ anaasɛ ebiduro no anɔpa na wafa abrɔfoduro no anwummerɛ anaasɛ ma 4 hours at least 4 hours ɛnna ntɛm.
dɛ onyankopɔn hyira sɛ wokyerɛkyerɛ mu megye di sɛ wonya wo deɛ me nso menya me deɛ ɛnɛ yɛsua bi de afa over the counter medication na supplements ɛnɛ ɛno ho na yɛba bɛsua adeɛ nso ɛtumi de afa ho sɛ yɛkɔ drug stores ahodoɔ akɔkɔtɔtɔ nduro self medications ɛne ahodoɔ bebree no ɛyɛ anaasɛ ɛnyɛ yɛfa no bebree no nso ɛyɛ anaasɛ ɛnyɛ sɛ meetena hɔ ama yɛre nso kumi no nso ɛyɛ anaasɛ ɛnyɛ nduro a wobɛbusa sɛ ɛka sɛ acetaminophen na yɛde ade sao before mo do part you would be
acetaminophen yɛ American way of calling paracetamol. Americans and normal every paracetamol acetaminophen. Nti a para in India and your friend acetaminophen.
No, you find it too much, you know. Rex factor based
yeah, one of the well-known and well-founded adverse effects of taking acetaminophen is hepatotoxicity. Hepatotoxicity, it's liver damage, cause liver damage. Often bebra, it may say or brabo.
Okay.
Inti omo ye acetaminophen and a Tylenol, any other brands of Parano. Almost set a safe limit for it. The safe limit is 4,000 milligram a day and a 4 gram a day. Into what paracetamol abroswa a day of 4 gram. Even though some other references say you can go as far as 7 gram a day. That's if it is guided medically, and I say guided by a physician or a pharmacist. You can go as far as 7 gram a day, but the safe limits are the man for OTC use, and I say for normal use, general use, 4 gram a day. Into obro sa 4 gram na okay can call obrebo a how now okay can call obrebo how so fabro so
one day be so one day pa
benyen so e
so boni so and a doc ase e was for when ka say you ko da mo so asena ye de edwumedi edwo boa me na ye kwaje aboafo krato ye ba e beto anso so timi e dem
now for me second paluta, yeah. I had you, inside I had you, outside I had you.
Medin edike edu gas oven. Kofa by na negina hay. Ye the gas oven abedwa so. Ye the gas cooker abedwa so. Ye the buffet dish abedwa so. Ye the kebab stand abedwa so. Ye mewu bo so nyina no eye ke edu gas oven sa no adwuma e na e twagu e wo TV ne so no. Enti wo to pa no meat pie cake ne shortbread. Restaurant, hotel, chobers, ahodo a moye ye nnuane no. If I hwehwe ke edu gas oven na beji bi wate. Gas oven no ye wo de for 2 bags. You want there for 3 bags. You want there for 1.5, 1 bag, half bag, quarter bag. Open big ketchup on the so kitchen. K edu ebema obi. Gas cooker no. You want there a soro no. A cooker. And you want there asian so ye oven. You have 4 burner with oven, 5 burner with oven, 6 burner with oven. Send you who TV so come on. What the so kitchen come on. Me patch of fibia ni ho. Oh chichi. And maybe I open the ye twagu e TV so ya frame. Na me no ni nkomo 0243 365873 e mane mo se obesende sika e de make edu gas owi be bia wo bia no ye be package na e de amane oni problem bia na opede agina ho nso a obegina ho acheche rice green rice blue rice nso a e ye ke edu gas owi o mpawe na opede e bi mpo paketu bi mpo na de ase o kitchen obeda bi hwehwe ke edu na e no ni dwuma ye wo Kumasi Swami runabout Post station ni nchemu ho abrepo junction kwa so ana mamponti aboa so that's why gas filling station K Edu gas oven ewo 0243 365873 0243 365873 K Edu gas oven na obetu yen nenso obebre
abaso baby say kodo me garden mercy
abusuafo yesanso amamakwa bio ediba eye hack me yaso subscribe, like, and share if my unions are more. A bit to me so I'll go near. Ya ring the paper, the back, one break, and first to bit to me a sea and a fine. And I say, no, you know, a boy, and I say, a dean. And it's in the attitude you made you offense your health, your wealth. Or pomoding a wahunya will be your swa. Now, if we are any dog or higher birthday and come a day of far yen a dry no over the counter. Yes, you know, I will be at their phone. You're true, do Basabasano, and I say, again. And doc, let me ask you this question or say, how can you safely use over the counter cold and flu medication?
Okay. Because I make safe use me person me kasaka krafa what cold and flu medications are and over the counter cold and flu medications what they are. You can't over the counter cold and flu medications. Indra, yeah, they treat catarrh, stuffy nose, runny nose, and can say flu symptoms and also cold symptoms. And obviously, many cold, many flu, many cold, many flu. Due to weather, seasonal changes are ebano, our bar. Na seasonal changes about and I say exposed to the weather no condition na it promote those conditions usually caused by viruses. Into yen time you sue antibiotics and treat those conditions. Usually, already treat here the cold OTC cold and flu medications. Into bine your nasal drops, nasal sprays. I been popular brands be the Otrivin. The woman is xylometazoline. And your xyloacino and also educrona.
Bo, esa ayo abubo yi no the scientific name ase dey.
Yeah, xylometazoline.
Is it-
Xylometazoline is the scientific name of the medication. And the warrior no, the other atoso xyloacino. But also the Otrivin ato ne dia so. And the tongue a drone. Your jet 2 code. It comes in tablets and suspension. Your Piriton, your cetirizine and arising, your loratadine. Nina your cold and flu medications are yedi treaty sa yarwa hodono. Inti ebani safety na as I say we treat bothersome symptoms first. Treat the bothersome symptoms first with one particular. It usually will require one medication, especially say a runny nose. You can go in for Otrivin. So person will go in for nasal spray and a nasal dropper. And I think the safest choice are to a boa. So go for nasal spray. You can even use saline drops, especially for children. You can use saline drops for them. And combine it and time you so all in one cold and flu medications. Wabra manifest a multiplet of symptoms. So manifest a multiplet of symptoms. Don't go in for an all-in-one cold and flu medications. Yes, you are just burdening your system with drugs, which will not help. And cold and flu medication will be what cold and flu medication will be what na para now sign for para. Inti offer para no assign can cold and flu medication now combine the dose are offered within a day. And one here you go overboard. Na wafa para no abroso. Na de how and so bro. And lastly I would say cautious with what do you call it? Treating the cold medication, cold symptoms, I would say cautious about what do you call it?
Everybody. Edu ko wona ba. Na o ka no bibi besi mi chim sisi am. Pese mi say no ma bay na wo se hwe over the counter. The medication label no no ma bay na wo se hwe wo.
Yeah. Eba over the counter medications labels no comes with the active ingredients of the medication, the uses or indication, the directions of use, the warnings or cautions. Nina information to the patient and yet information to the patient and the pharmacist. Yeah. Inti I was a pharmacist no effe na utritre ma patient na tiase. Se pharmacist no ent me aye sample a wo patient no I was a utimi every tiase na for your own safety. Already tiase said the bear ebe boa ma watimi hu how best enduro no ebo. Inti yemfa na say awofo bi koto cough preparation bi ama ne ba wedi be 6 years. Also 6 years those are also offer nina e wo label no nti wohwɛ drug leaflets and drug labels and even the boxes, some of the boxes na ɛwɔ ho na ɛyɛ ɔmo twerɛ ne nyinaa wɔ ho nti as a parent, as a guardian, as obi a wokɔtɔ OTC medication, you have to look for all these informations na ɛboa ɔma wotumi yɛ guided ɛwɔ nnuro no fa and how a wɔbɛ administer no safely a nkɔfa ha ɔbia mbrɛ.
Yɛmfa yɛtwa to na yɛmfa dwumadie no so ɛnsi ɛwɔ ha no sɛ doc mekɔ hyɛ twa to no sɛ kwan bɛfa so choose the right over the counter medication for allergies.
Okay. About allergies nso a nnuro a yɛtaa use for allergies yɛ antihistamines. Antihistamines na ebi ne rising, deɛ ɛwɔ mu yɛ cetirizine, ebi ne loratadine, ne brand yɛ ne one of the well-known or original brand yɛ Claritin. And they usually come in the name Loratadine. Your Desloradenk, and Desloradenk, and I will chlorpheniramine, and that's a Puritan. Your Benadryl, Benadryl. Your all these medications, and a diphenhydramine are you use for allergies. Into depending on the child's age, and I said the person's age, the person's weight, and certain factors, and they choose those medications. And besides, so usually say a runny nose, rash or something. Usually we go for any of the loratadine or the cetirizine. And I say a could be a bar and a drawer. You prefer to go for the ones that can help you sleep. And diphenhydramine, one of them are it means used to sleep. Aside boy with allergies, no, it means used to sleep.
Okay.
And even cetirizine causes mild sedation, but very idea causes sleep, sir. And I those ones are during the day you use. It say we will be during the day. You wouldn't want to go for idea because drowsiness during the day because they be active during the day, especially drivers. We all driving as all that say cause accidents see nina nyoma yehwe the guiding in our choice of OTC medication.
Let me trust about. See, OTC sleep is safe for long-term use.
Okay, mostly not. OTC medications for sleep aids, no, you use for short term.
Okay.
Last time na patient be by me ho, pharmacy na menene di nkomo wafa OTC sleep aids na ma say no men kan say ofa no triple cry into wafa no ono cry the end there is being prescribed for him. I think his wasn't OTC. But it's a sleep aid. But our farmer is often a triple. Any the best. You'll be reliant or dependent on the drug for sleep, which wouldn't be the best. For sleep aids, for sleeping the best necessary better sleep hygiene. That's maintaining a regular schedule for sleeping, avoiding screen time during bedtime, making sure your room is dark, taking your bath in the evening, and other things it may facilitate sleep.
wo so no you no put me do
Nti obiara ne system. Yeah. Nti ba
say ye fedru and I say ye fedru ansan ya da no emmoa.
yeah, it's not the best
Because
for a
naturally,
long
you know,
term
so it's
use.
me da.
Yeah, for long term use.
Okay.
Adeɛ baako a ɛkɔ so sese paa ne sɛ saa nnuro na ɛkɔ OTCs na ɛtumi induce sleep te sɛ diphenhydramine no. Ebi wɔ some cough preparations mu anaasɛ ebi wɔ some preparations bi mu a syrups bi mu a sese abɛyɛ drugs of abuse. Ɛno na ɛma yɛyi codeine free market.
Okay.
But they say drug abusers no oma your many free codeine so because a bit that so use codeine no underground I chom so omo be chom but say no adia omo atu many so e diphenhydram ebi wo Ritalin mu ebi wo Samalin mu yeah omo abuse no pa yi nti eno nso ya dia o rely on it bebree for sleeper enya ade beboa nti
Okay. No, yeah, that's it. I don't know why everything nyina enso aba no awie over the counter medication and supplement ene we be so ahwade enye duro bia na ese woto edo no to a say doctor a prescribe enso etumi ade am self medication no eya na emmo ni pedua no eya na sinto akra enso etumi ebe obu ani tani na koto eya duro no no nika say ebia na bi fufuro ene bon kaye enso so eja ene painkillers ahodo no ono no so na baby fufuro so ye dey say make catch us say you make quiver the machine aside you made it me at the person asana o dear face 0540748951 you know because sana so to me aso asana abo o get to do so to me edi amount enta make catch us say wujo not excel and so e boy aso asana bia so etimi ay kama say ope e nwandu supplement dia enfo ni enchi bebia fe no be no screen aseno ofo mo a bebi wo bia betimi edi so etimi edi ado mo mo ye nnuane ahodo nnuane adansa kese no okoport ne mo entifo ni chim okeyedu na omma eye stove papa betimi aboa yese ope be 5 banners ani nyina onsanso betimi aka betimi aboa obutu eye so police station echi ope na obutu de djuma okwa wo se hack media se memra obima o discount yakopon esha so boa ye yes subscribe like nation meeting edin ranting nyame pa e be se